to your posture. Okay, so recently I met a lady, and she was complaining of a lot of headaches and pain around the side of her face, more on one side. And then she had headaches that were coming up this way. And she felt a lot of tension around her neck. Okay, so basically, she was not able to sleep at night. She had a very stressful job, and she had a history of clenching her teeth at night, which, of course, made all the tension around this area even worse. And yeah, so basically she was not able to focus in the morning because she couldn't sleep well, and that was increased stress in her life, in work and at home. So the reason I'm telling you this story is because some of you might have the same issue, but unfortunately, jaw pains are not spoken about as much as your back pain, neck pain, etc. And especially jaw pains are not talked about in relation to having a poor posture. So I just thought I'd talk about this today in case it is helpful to you. So, those of you who don't know me, my name is Swati. I'm a physical therapist. And yeah, I just hope this video is helpful for those of you who are suffering from the similar symptoms or condition as this lady that I met the other day. So, basically, what happened was going back to our story. So, this lady went to a dentist to sort out this issue, right? And what she realized was the dentist, I mean, he tried to manipulate around the jaw, and he did whatever he could. The problem got sorted out for a bit. But it came back. She went to the doctor. The doctor gave her some pain medication, told her not to chew on very hard foods, and told her not to use the painful side as much and probably chew from the other side. But then nobody could actually figure out what was the main problem. So basically, she never found a solution. So when I saw her, I actually saw her for another issue she had with her foot, right? So but when I look at a person, I would look at them from head to toe. First, analyze their posture, and because the way you're standing would obviously affect your feet. But then if you find something else that's affecting the person, then I would advise on those lines as well. So it's not that if you come to me for an ankle injury, I'm only going to treat your ankle. I'm going to look at you as a holistic person as a whole, and not just as an ankle that's presenting to me, right? So she said the doctor couldn't help, the dentist couldn't help. So you know what the doctor told her about the medication and not using that side? It's similar to, if okay, let's look at the ankle. So I told her it's similar to if you have an ankle injury, right? You come to me and I say, oh, the problem is that you're putting too much weight on the injured ankle. Sounds fine up to now, but then what I say further is, oh, you have a problem with your ankle, you have an injury. Stop using this side, the ankle on this side. Just use the uninjured ankle, and just take some painkillers. It'll go away. It doesn't. It needs to be rehabbed. It needs physiotherapy. It needs so much more, right? You need to train the balance, the muscles, everything. So, what will happen if this patient goes back and starts to put double the amount of weight on the uninjured ankle? And say they have a flat foot, that means your foot does not have this inner arch, and it is more flat, so they tend to roll in a bit more. And if the patient is like that, they have a foot like that, which is more flat, they will be more prone to ankle injuries. Now, on top of that, I have asked them to load it, um, and not load the injured side. So you see what's happening here is there is a biomechanical problem. And on top of that, I have, sorry, I have actually loaded the joint even more. So you see, I'm actually spoiling things and making matters worse rather than sorting it out, right? Same thing. If you have a jaw problem and somebody tells you, oh, just don't use that side, the pain will go away. No, it will not go away, because the pain might be coming from a postural issue. Now, with this patient, we got really good results. This lady, I got her to the level where she was able to self manage her pain, and she knew why it was happening, so she was more aware. and she could manage things better. And eventually her jaw pain went away, right? So what happens, or how is your posture related to your jaw pain? So this lady, when she came in, she had a forward head posture. So basically she was here, right? So what happens with the forward head posture is, when you have your neck, this is neutral, when you have your head protruding out, try doing this. Protrude your head out and bring your shoulders up. This is exactly how she was. Oh, this is so uncomfortable. Try doing it, okay? So I need to shake it off. So when you are out here, forget the shoulders, just this part, right? When you're out here, what happens? Your lower jaw bone is actually, it stays here, and the upper part, this whole skull, this actually moves forward. So if this is, say, my upper jaw, it's here, and the lower jaw, instead of sitting here, it's actually sitting back. So you see the distance that increases. Now what happens is, there's a lot of stress on your TMJ, which is your jaw joint. It's called the TMJ because it's basically, this is the mandible. This is a separate bone that attaches to the temporal bone here, which is a part of your skull, right? If you've seen the skull, the skeleton. So this is the temporal bone, and this is the mandible going here. So this is called the temporomandibular joint. Anyway, so let's not get into the technical side of things. Basically, we, for the sake of simplicity, we'll call it the jaw joint. So what happens is, your lower jaw bone is sitting behind, and the upper part, this head part, is actually sitting forwards. So you have a misalignment here, right? So if I keep correcting the misalignment at this area, but I do not correct the basic cause, which is your forward head posture, you will not get long-term relief, right? So just referring to my notes here in case I missed something. Yeah. Okay. So what happens is, firstly, there is a misalignment at the jaw, right? So suppose my right side is affected. What will happen is, these muscles around the jaw, especially this masseter muscle here, it will start to have trigger points, or focal areas of tightness around the muscle, right? That will lead to even more pain, right? So you see how things sort of build up on each other. So if you correct your posture, you will be able to address the jaw pain and also the headaches that would originate from this area. Right. So when you have a forward head posture, it's not just the headaches that originate from here. They can affect the jaw, and then this can be really painful and manifest as headaches coming up here. Similar to, when you have a dental problem and then you get headaches coming up the sides of your face and around the head here, similar to that. So yeah, uh, if you want to know more about temporomandibular joints, or headaches, or tightness around the jaw, or this forward head posture, go to my blog. I'll leave a link in the description below, and for those of you who are watching me on Instagram, the link is in the bio. I will also leave a link for my forward head posture blog, so you can have a look and see what are the manifestations, how can you correct it. It does show you corrective exercises for forward head posture. So what I'll do is, I'll leave the blog link below for the TMJ pain, so you can identify the 5 points that will help you identify if you have a TMJ problem. Okay. So yeah, if you have any questions, as usual, feel free to ask me. If you want to have a chat with me, just message me and we'll book in a 10 minutes free call for you, and we can take it on from there. All right. I hope this was useful, and I will see you guys next time. Okay, bye.